Hello everyone, this is Anchal Gupta, founder at Sorgen, and today we are so privileged to be here with Dr. Madhuri Gore at a clinic in Chembur. Dr. Madhuri Gore has been the professor and head of department surgery at Sion Hospital for several years, and now ma'am is practicing as a consultant surgeon and Phlebologist at Dr. Gore's clinic at Chembur.
Hello Anchal.
Hello ma'am.
Nice to talk to you today. This particular month is declared as DVT Awareness Month, and so we thought that we should be discussing the issues that occur with DVT during travel particularly, because now the exams are starting. After that the vacations would follow, and then as Indians we do like to travel a lot, and so everyone must be planning the travels during vacations and during summer particularly. So we thought we'll talk about DVT today, and we'll focus on DVT and travel particularly.
Right ma'am. It would be really nice if you could let our audience know what really is DVT.
DVT, the long form actually is deep venous thrombosis.
Right.
And what are deep veins? In our body, we have veins at two levels, particularly in lower extremity and upper extremity. The deep veins pass through different muscles of the leg or of the arm or forearm, while superficial veins are just under the skin. The deep veins are covered around by the muscles, and when these muscles contract, it helps in pushing of the blood through the vein towards the heart. When a clot develops in deep vein, that is termed as deep venous thrombosis, because thrombosis means a blood clot.
Right. So why is it that DVT is likely to occur during travel, ma'am?
The travel may be by any mode, whether it may be by plane, by bus, by car, or by train. Any travel which lasts for more than 4 hours, that is what the data shows, is likely to cause development of deep vein thrombosis, particularly in leg veins, but occasionally in the veins of the upper extremities too. And now why does this happen? During travel, particularly prolonged travel, we are sitting for most of the time, and sometimes sitting in a very cramped position where we cannot move our legs. As our legs are not moving, we are not walking,
Right.
we are sitting in just one fixed position.
Right.
The leg muscles, which normally push the blood upwards towards the heart, are not working. We are just sitting
Yes.
throughout the travel. So the blood gets pooled in the veins of our leg, and this pooled blood leads to what we call as venous stasis.
Mm-hmm.
There are main 3 causes why deep vein thrombosis develops,
Mm-hmm.
and the important one is venous stasis.
Right.
And during travel, that is one thing that happens. The second cause is vein wall damage.
Mm-hmm.
When we are sitting in a seat, most of the times the edge of the seat rubs against the back of our knee.
Right.
That is the area from where the popliteal vein, which is important
Mm-hmm.
deep vein, that can get damaged. The wall can get damaged because the seat edge is moving or pushing or acting against that particular popliteal vein and can cause vein wall damage, which is the second cause why DVT can develop. And the third cause, which is most importantly
Mm-hmm.
observed when we are traveling by plane,
Mm-hmm.
is that the air in the cabin of the plane
Yes.
is slightly at a lower pressure than outside.
Right.
So this is what we call as hypobaric oxygen. That means it is at a lesser pressure.
Yes.
This hypobaric state itself can stimulate the coagulation process. Coagulation process is what is responsible for formation of a clot.
Correct.
So there are these 3 factors which come together particularly during air travel, and of course to a lesser or greater extent in all other modes of travel.
Right.
So we must understand that there are changes happening in our normal body mechanisms that prevent clotting normally are all disturbed when we are in travel, and that is the main reason.
And this could be for any travel beyond 4 hours.
Yes.
By any mode of travel.
Yes.
That is the flight or a bus, train, car journey.
Correct.
Any form of travel.
Yes.
Having understood, ma'am, now that people traveling for over 4 hours are likely to develop a DVT, is it true that everyone who travels can develop a DVT, or there are certain kinds of people who are more likely to develop a DVT or more likely to be at risk of getting a DVT?
Very important point. Everyone who travels for more than 4 hours is likely to develop a DVT.
All right.
But there is a certain group of patients or individuals who are more likely to develop this DVT. And this particular group of persons mainly consists of people who are of advanced age. So anybody more than about 40 years of age is more likely to develop DVT.
Okay.
And you know that our lifespan is increasing day by day.
Yes.
And we have our own close relatives staying away from our country.
Yes.
So a lot of elderly people are traveling.
Yes.
And so we are seeing actually more and more patients who have traveled a lot distance and they come back with deep vein thrombosis. Besides this, another important factor that increases the possibility of developing DVT during travel is obesity. And obese people are more likely to develop thrombosis. Then again, we have persons who have undergone surgery recently.
Right.
Or females who have delivered recently.
Right.
And this recently means a period of about 3 months.
Okay.
The patients or individuals who are on hormone replacement therapy, chemotherapy, or on oral contraceptives, they all are more likely to develop thrombosis.
Right.
If the mobility is affected because there is a fracture in the leg or because of any other condition, the individual is not able to mobilize well, not able to walk properly, he or she is also likely to develop thrombosis in the deep veins. Patients with cancer, patients who have catheters in veins in the body, maybe for receiving chemotherapy or something, are also more likely at a risk of developing DVT. Varicosities, which the patient has, also makes it little more likely that the patient would develop thrombosis in the deep veins or in the superficial veins themselves.
Right. Thank you, ma'am, for letting us know the kind of people who are more likely at risk to DVT. As you said, everyone is at risk, but there are certain set of people who are more likely to be at risk. Having said so, ma'am, is there a way to know the signs and symptoms? Like, how does one, suspect that one is getting a DVT?
Suspecting that you may have DVT is extremely important, because we should realize that almost 50% of people who do develop DVT may have no symptoms at all. So unless they think about DVT and then get themselves examined by appropriate specialists in this field, the DVT may not be diagnosed at all. So what are the symptoms of DVT? And that we must remember these symptoms and be on lookout for these symptoms so that we can seek treatment or advice at the right time. So these symptoms can be swelling of a limb, particularly one limb only. Both the limbs won't be swollen, only one would be swollen, the one that has DVT in it. Pain in that particular leg, or when you touch that leg, it is tender, it becomes more painful. And skin over that leg is warmer. The leg color may or may not change, but a reddish leg, painful leg, swollen leg, and a tender leg certainly should make one suspect that he or she may have developed DVT during travel. And the period for which you should be observing for this is most likely 8 weeks, up to 8 weeks after the travel.
Oh, that long, ma'am?
Yes. The effect can last, or the presentation may be there within up to 8 weeks after travel. Maximum up to 4 weeks, but after 8 weeks we can say, okay, now this person is not going to develop DVT
due to the travel.
Yes. But more important than this, I think, is what we call it as a silent killer.
Yes.
And that is pulmonary embolism. A person may not have any symptom of DVT as such, but this clot can get dislodged from where it has formed in the leg vein and travel into the pulmonary artery that carries blood to the lungs, and that is called as pulmonary embolism. This can lead to multiple symptoms, right from sudden death to feeling of faintness, dizziness, breathlessness, or difficulty in breathing, breathlessness on minimal activity. So one should be on lookout for these symptoms too, so that we can diagnose pulmonary embolism and treat it appropriately before it can lead to possible fatality also. And that's a very important factor, I think.
So that is why DVT is known as a silent killer as well.
Exactly.
So, is it likely that all DVTs can lead to a pulmonary embolism?
No, not all DVTs lead to pulmonary embolism. It's only a small percentage of DVT that leads to pulmonary embolism, and it varies from where the embolus is, from 1% to up to 5%.
Right. They say, ma'am, prevention is better than cure. So, yeah. So who better than you to guide everybody on what kind of precautions that we all should take before we endure the next long travel?
Yes. As you rightly mentioned, each one of us has to take precautions, whether we are 40 or we are 40 and above. Everyone has to take precaution. And certainly, as we have already discussed, the people who are at a higher risk for development of DVT may need to take certain special precautions. But first, let us see what are the common precautions to be taken by everyone.
Yes.
As I mentioned earlier, DVT mainly occurs because we sit at one place and we are not moving.
Right.
Actually, we all know that it's very difficult to move, particularly during a plane travel. Aisle seat is the best seat that allows you some space for leg movement.
Yes.
But then everyone who is in the plane simply cannot get an aisle seat.
Absolutely.
So what do we do for that? It's most important that we start following simple instructions. 1, drink lot of water during the travel. And please understand that I mentioned water. Try and avoid alcoholic drinks. You also should avoid long sleeping spells. So sleep for maybe a couple of hours, get up, do some movement, then go to sleep again.
Right.
So if you are on a long flight, like 16 hours flight, don't sleep for 14 hours out of those 16 hours. Take breaks in the sleep also. So you get up in between and do some movement. Now, what movements can you do? Simply while sitting in your chair or in your seat itself, you can do certain leg exercises. To avoid pooling of the blood in the leg veins, we should be doing exercises while sitting on the seat in plane or even in the car or bus. These are very simple exercises, and this involves stretching your leg intermittently. The second exercise is flexing and extending your ankle up and down, rotating your foot at the ankle in both clockwise and anti-clockwise direction. The third simple exercise is putting your feet on the ground, lifting your heel and then touching the ground. This is also called as tiptoe exercise. This gives good exercise to the calf muscles and helps in pumping of blood towards the heart. The last exercise is holding your knee, bending your knee towards your chest, holding it for about 10 seconds and then extending your leg again. Do keep on doing these exercises at the frequency that you can while sitting in the seat itself. And if you can walk, that is even better. So your aim in doing all these leg movements is that there should be action of the muscles of the leg and movement of the blood in the veins towards the heart. So there is no pulling. If you're traveling by bus or car or train, it is a good idea to get up and walk in the aisle. It's rather not possible in the bus.
Yes.
And certainly not possible
In the car. Yes.
But then, if you're traveling by car, you should plan stops
Right.
at least once in 2 hours.
Okay.
So that you get down the car and you walk during that period.
Right.
So take a break every 2 hours during your long travel.
Right.
And that is possible when you're traveling by car. As far as possible, avoid travel when you have recently undergone a surgery or you have recently delivered a baby or one is pregnant. Please avoid travels. Repeated travels one after another, particularly over long distance, is not really a good idea, and you need to take real sincere precautions, and we'll come to those special precautions a little later.
Right.
So you plan movement of your legs and ensure that you do it religiously. We do have mobiles, everyone is carrying different gadgets. It's not difficult to put an alarm to make you alert about that now it's the time for you to exercise your legs. And you can do that certainly.
So how often the leg movements should be done, ma'am?
As often as possible.
Okay.
But you do tend to sleep, but put an alarm to get up from sleep.
Right.
Do movement of your legs. And these movements and exercises can be done while you are in the seat itself.
Absolutely.
If you get an opportunity, do use that for walking in the aisle. Or some planes, particularly like Airbus 380, have a open space where you can really take a good walk in the plane.
Right.
But then that may not be possible in some other planes.
Right.
So best is to keep on moving your legs while you are in a particular place.
And also being well hydrated, as you mentioned.
Very, very important. And if not for anything else, you can certainly visit the lavatory in the plane and try and move your legs there, stretch your legs there.
Yes.
And if your legs are actually rubbing against the seat edge, try and move that. Or in fact, I read about a very interesting use of that squeezy ball that you can keep behind your knee when you're sitting on the seat, and then just keep on rolling your leg over that squeezy ball.
Right.
So that the seat edge doesn't rub against your popliteal fossa.
Correct.
Popliteal fossa is the part just behind the
knee joint.
Other ways to stretch your legs in front of your seat itself. So as far as possible, try and avoid putting your luggage under the seat in front of you.
Right.
Because then you will not have space to extend your
as it
legs.
is, there's less leg room, and you will be even obstructing the little room that you have.
So don't put things in front of yourself under the front seat, so you can extend your legs. Other precautions that you can take are simple: wear loose clothes so that you can move your legs more easily rather than wearing tight clothes. So you are more comfortable, you can move, and your mobility of the legs also improves when you are wearing loose clothes.
Correct.
There are certain very, very specific and important precautions that are necessary for a special group of people. And which is this special group? What I mentioned earlier. The people who keep on traveling every now and then. People who have to travel practically every week or maybe every fortnight. These are the people that even before there is a chance to detect a DVT that has developed during previous travel, they might be undertaking another new travel.
Absolutely.
So these are the ones who must take special precautions for preventing development of DVT. And these may be use of a compression stocking, which gives a pressure of around 30 millimeters of mercury around the ankle, and it decreases as we go up the leg. These are below knee compression stockings, and these stockings should be worn. The pressure that it gives should be decided by a specialist who should be consulted before undertaking such multiple flights. So people who have already developed DVT due to any cause need to take even more precaution because they would be on anticoagulants.
Right.
Anticoagulants are medicines which help in stopping the increase in the size of blood clot. And one should avoid any travel for at least 4 weeks, and certainly long travel for at least 4 weeks after starting of anticoagulant therapy. And these individuals should certainly be wearing graduated compression stockings when they undertake travel. Patients who have developed clots earlier and have completed their treatment also need to use compression stockings, and they may also require a prophylactic dose of anticoagulation. But remember that all decisions should be taken by your specialist whom you should consult before undertaking travel. During pregnancy also, precaution needs to be taken. Immediately after delivery, if you're going to travel with the baby to your parents' place, which happens so very often,
Yes.
Appropriate precautions need to be taken, and additional precautions, as I mentioned earlier, also may be required in these individuals. So these people should consult a specialist in this field so that they take adequate precautions to prevent development of DVT.
So, ma'am, it is clearly understood that the special group people who require to travel, who belong to the special group category, need to definitely visit their doctor and understand the modality of treatment, whether it's anticoagulants and the pressure of compression stockings that they need before they have to make their next travel. What about the other group of people, ma'am? The rest?
As we mentioned earlier, the risk of development of DVT is there even in other people who don't have any special factors.
Yes.
So they too need to take precautions, and they too need to take the precautionary methods and measures so as to prevent the development of a deep vein thrombosis.
Yes.
And we have demonstrated the exercises,
Correct.
even the instructions as to what they should be doing.
Right.
And additional precaution they can also take is wear support kind of stockings to give them appropriate pressure around the ankle and the calf, basically.
Right.
So that they wear stockings with supportive pressure, and that gives a good compression over the veins and helps the calf pump action so that the blood doesn't get pooled in the legs.
Correct.
And they don't develop any swelling of the leg, which occurs even in people who have absolutely normal veins.
Absolutely. So the rest of the people can wear moderate graduated compression
Compression
stockings
Yes.
to reduce
certainly.
their risk of DVT.
And I think if everyone follows these instructions, they will certainly have a safe flight. And I hope that you all do listen to these instructions and follow them. I think we have had a good discussion about DVT
Yes.
and travel. The vacations are arriving. I'm sure you all are planning travels to some beautiful places and to meet friends and relatives. Please do follow the instructions that we have given just now and have a happy travel.
Thank you, ma'am, for your time. And it was absolutely a wonderful session. Friends, this is the DVT Awareness Month as well. So please share this video with your friends and family. And DVT is a silent killer, is very dangerous, but is also preventable, as informed to us by Dr. Madhuri Gore. So take care, stay safe, and happy travels.
Thank you.